I knew I wanted to be a nurse midwife when I had a life experience that showed me that women need really good care. I was at my daughter's basketball practice and her friend said, "My grandma is a wonderful labor and delivery nurse." That moment was like the ceiling opened up and a beam of light came down and said, "You're going to be a midwife." And I'm like, of course, I'm going to be a midwife. I chose medicine because I wanted to make a difference. And I think if you want to help people, help the mothers. If you help a woman, it helps her whole family. People are becoming more aware of midwives and midwifery care, and they're seeking that kind of care because they want that personal attention and the safe evidence-based care that we provide. Healthcare systems are realizing what a value midwives bring to them and to their patients. One of the advantages of having a midwife in a hospital setting is you can have a high-risk pregnancy but still have a low-risk hands-on delivery with the midwife. And that's the best of both worlds. The woman-led model of midwifery care is where we present evidence, information, and allow the woman to make choices about her care. I really love my patients. I went into midwifery because I care, because I want each woman to feel like someone's listening to her, because they want someone to hear them, to see them, and to give them good care. I'm Karen Ady. I'm a certified nurse midwife practicing at Intermountain Health.